Hey, Foot Geeks fans! Today we're here with Amar from the Workshop Clinic, and we want to talk about Shockwave Therapy. Now, what exactly does Shockwave Therapy do?
Shockwave therapy essentially, to put it really simply, it kind of shoots an area with electric current, and the idea is to irritate an area that's an old injury or a chronic injury to kind of reset the healing process. So it kind of promotes inflammation. So inflammation is your natural first step of your body healing itself, and it's actually a good thing. So especially for chronic conditions, it's really good. It just kind of resets it and gives your body that trigger that it needs to kind of send blood and good nutrients to an area to kind of heal it more fast.
And what do you use it for in the clinic, mostly?
So it's generally used in a situation where an injury is chronic and it's not really getting any better and it's kind of stuck at a standstill. So it's especially good for tendons and tendinopathies. It is commonly called tendinitis, but we don't see it as an inflammatory condition anymore. But for tendon is amazing, and it's got great research behind it. Because tendons have bad blood flow naturally, it kind of just hits the tendon and really promotes blood flow and collagen formation to kind of really rebuild that tendon and get rid of that chronic pain you have.
So your number one tendon would be the Achilles tendon, I'm assuming, that you're treating, or is there other tendons that are very common as well?
Honestly, rotator cuff, rotator cuff, patella tendon, Achilles, plantar fasciitis is another one too. What people understand is the plantar fasciitis pain by the heel is actually where the tendon is. So you hit that, and it actually works really well.
Okay. And with plantar fasciitis, I mean, again, the idea is to draw blood to the area to help it heal itself faster. Is that kind of the major?
Yeah, exactly. So it's generally 4 sessions over a month, and then just let it do it, and then that's pretty much it. Anything past that is kind of like obsolete or useless in a way. The research shows those 4 sessions. So we use it a lot for plantar fasciitis because generally people that have plantar fasciitis have had it for a long time, a couple of years. Sometimes 3 to 5 years, and a lot of times when you just hit it with the shockwave, you really don't need to do much else. A lot of times it just heals itself, and it's a lot better. It's kind of like an alternative to, I don't know if you've heard of the injections that people usually get in their foot, but we don't really promote that. We're trying to give it a more natural healing.
So, and then if it doesn't solve itself after 4 weeks, what are the other options for treatment?
So generally it does. To be honest with you, like plantar fasciitis is not that hard to treat. Then if it's really, really bad and nothing helps, then the last option would be like another opinion, whether that be surgical or naturopathic or anything like that. Like I would probably suggest a naturopathic referral before surgery any day of the week. Just because they have a different skill set that we don't have. So I would refer on it, more or less. Like that means I've literally, the shockwave is my last resort. And if I can't get it better with shockwave in those 4 weeks, then someone else can probably give me a better perspective on it. So probably naturopathy, more or less.
Awesome. And check out our next video to learn more about how physiotherapy can treat plantar fasciitis. If you have any questions regarding Shockwave Therapy, post those below. If you haven't subscribed to our YouTube channel yet, do so up there. Have an awesome day.